Hello, this is Dr. Virginia Ellis over here at Virginia H. Ellis DDS Dental Corp. Today we are going to be touching up on a very important topic, oral cancer. And hopes or with the goal of helping you understand how to kind of look for it and why it is so important for you guys to come in for your routine maintenance recalls and your dental checkups. So the first question is, Dr. Ellis, what is oral cancer? Well, oral cancer is cancer that is located in your head and neck region. So basically, when you come in for checkups, we look for cancer. It's cancer that's in the sides of your cheek, on the roof of your mouth, maybe on the bottom of the tongue. Here, it's called the ventral side of the tongue, the floor of the mouth. Here, it could be in your throat, okay, or in the back of your throat, your head and neck region, okay. That's basically cancer that is in your mouth, your throat, or your head region. The next question is going to be, what causes oral cancer? Well, obviously many things can cause it, but a lot of the things that are linked in dentistry with oral cancer that predispose you highly to developing it is mixing alcohol consumption with tobacco. The carcinogens, the chemicals causing cancer, are easily solubilized or soluble, and they blend into the skin of your mouth. And when that happens with the mixture of alcohol, when you're consuming tobacco products, it greatly increases your chances of getting cancer. So consider before starting those habits. And if you need to stop, give us a call. There's plenty of resources if you want to stop using tobacco or alcohol. There are plenty of resources that we can guide you to help you stay healthy and live a longer, healthier life. All right, the next thing is, what are the early signs of oral cancers that patients should look out for? Well, basically, lumps and sores inside your mouth. That would be the number one thing. A lot of times people come in and say, Dr. Ellis, I've had this sore. Can you look at it? And I look at it, and I can tell you whether it is likely cancerous, or maybe just watch that inside the mouth. If you have something that looks chalky white that hasn't healed in about 2 weeks, you need to come let us know. The rule of thumb is, if you come in for a checkup and you have like a red mark, a white mark, something swollen or bumpy, and it hasn't healed in about 2 weeks, the usual protocol or mode of operation is to go ahead and refer that. And then when we refer you to specialists, what they'll usually do is take a sample of that area and send it for a biopsy, because a lot of times you don't really know for sure what it is until you biopsy. You look at the cells under a microscope and get the report back. So that's what we usually look out for. Lumps that are usually not gone by about 2 weeks, and sores in your mouth, or discolorations that don't look right to you. Your gut is usually right when it comes to that. Oh, I'm not sure if this is normal. Come and get a checkup with us and we'll let you know. Okay, the next question is, what are the most common symptoms of oral cancer? Again, it would be something like having discoloration in your mouth, okay, that just doesn't look right. White discolorations, red discolorations, sometimes they're black. Bumps or hard nodules inside your mouth, just come and get those checked. Sometimes they're in your throat, like when we're feeling over here. They can be, not always, so don't freak out. Just come and get yourself checked over here, okay? What does oral cancer typically look like in its early stages? Well, like I just said, sometimes it doesn't look like much. It can look like just a sore or a lump. White, when you have white types of cancer, leukoplakias, it looks really white. It just doesn't look, it almost looks like white like this against your skin, and that's not usually normal, okay? So any questions, just come over here. We got the trained eye for you. Are there specific areas of the mouth where oral cancer is more likely to happen? The most common parts that are affected by oral cancer for a lot of cases is the borders of the tongue. So basically, the sides of your tongue and the floor of the mouth, which is, this is the floor of the mouth, and the ventral part is here, that's the bottom of the tongue. Your soft part of here, that's the floor of the mouth, okay? Those are the more common ones, and sometimes you can get them on the sides of your cheeks here, okay? I'm kind of using myself as an example. and there, and that's called the buccal mucosa. And sometimes the hard and the soft palate, we all know where the soft palate is where the softer part of your back or the throat is, okay? Can a lump on the gum be a sign of oral cancer? Not always, yes it can. Usually it's a sign of an abscess for most people. It can be a sign of cancer. An abscess, in case you wonder, it's like it comes from an infection of, say, rotted tooth, a cavity that has expanded and gone inside the tooth where you need a root canal, and now it's like spreading over here into the gum. Sometimes you have like a pimple-looking lesion that's draining pus. Sometimes you get a funny taste, but once in a while you can have a growth that is cancer. Best thing to do again is just come and get it checked by us. That will give you the best information to know what to do next, okay? And if you have cancer, what to do to prevent it from becoming life-threatening or just disfiguring. All right, what is the connection between, this is important, HPV, human papilloma virus, and oral cancer? Well, there have been certain strains or types of human papilloma virus, in particular type 16 and type 18, that have been directly linked to oral cancer. And the connection between that is that a lot of times it can be directly, here's something that most people don't talk about, but it's something to know. There is a connection between genital warts and HPV. A lot of times when we see patients with oral warts, warts in your mouth, that is a direct link of the connection between HPV down south and here up north, okay? So you want to just make sure that if you have a wart in there, that you get that taken care of. I usually send those to the specialist to remove them. It's always good, and we look to make sure that you don't have anything that's questionable growing in there. So if at any time you happen to have a wart in your mouth, that is directly related to a human papilloma virus, and it is directly related to oral sex connections. So you want to just take care of that. We will discreetly refer you to the specialist to take care of that and make sure that you're well taken care of. But there is a direct correlation between the connection of HPV and orally sexually transmitted diseases, because the skin in the mouth is very similar to the skin in your private genital area. All right, in case you ever wondered. The next thing is oral cancer diagnosed during a dental visit? Yes, it can be. And a lot of times if we catch it early, it can make a life-changing difference, because if you catch it soon, it could save your life, it could save your tongue, your jaw. If it's not caught on time, a lot of times you have to cut like your nose or part of your jawbone, and it disfigures your face. It obviously affects your quality of life, and you don't want to do that. And also the thing that's really important about oral cancer is that you have glands in here, right? Lymph nodes. And if you have cancer that's in your mouth and those cancer cells reach the lymph nodes, then it starts to spread all over your body, and that's when it becomes metastatic and metastasizes or spreads to the rest of your body, and then it kills you. So that is super important or imperative as to why you need to come in for your dental checkups to also screen for that. It'll greatly decrease the likelihood of you being diagnosed with cancer, oral cancer, at a later stage. Nothing guarantees that we won't catch it, that we'll catch it, but the chances of us catching it earlier is greatly increased, right? And it's good for you. What does oral cancer screening involve? Basically, when you come in, we look inside your mouth, outside of your mouth, and I look with these special lenses. So these are like microscopes in your head. They're huge, and the light is really, really strong. This light here is actually stronger than that light over here, okay? Who would have thought, right? So we can really see a lot more than you normally would just visually without the help of scopes. Yeah, these are scopes. The next question is, what are the current treatment options for oral cancer? Well, obviously, if you have oral cancer surgery, if you catch it early, a lot of times it's biopsied and a lot of the stuff is removed. If it's not caught on time, then you have to do things like radiation therapy or chemotherapy. So if it's caught on time, sometimes just some extra surgical removable of the skin or parts of the mouth is what is required, but hopefully you catch it earlier than later. and that's usually all you need. In advanced cases, you would require chemotherapy and radiation. How important is early detection when it comes to oral cancer outcomes? Super important because of the reason I just stated. You have the lymph nodes here. You want to catch oral cancer before those cancer cells reach the lymph nodes and start to spread. You also want to catch it when it's small, and removal of the cancer parts of your mouth and your head and neck are small, and you don't have to remove parts of your jaw, your tongue, or your nose or your lip, and that will make a big difference in your life. Okay. On a side note, one of the biggest things I catch is skin cancer. So even with people who go regularly to the dermatologist, some of these people go once every year. We see you guys like once every 3 to 6 months. So because you guys come in here every 3 to 6 months, I'm able to look with these special scopes in here and really catch things at an earlier stage. If I catch them or something's questionable, I tell my patients, go see the dermatologist. And I have had cases where patients have come in having recently seen the dermatologist, second set of eyes, looking out for you. Takes a village. We catch it, send it back, and I've saved a few noses. I'll just say that, okay? One of my one experience that I remember, I just started working for another doctor in another practice. Second week in, one of the patients had just come the previous week to get her checkup. I see something questionable. Hey, don't worry about it. Just go get it checked. Surely enough, she came back at her next checkup, and she said, the doctor told me if I had waited another month, I would have lost half of my nose. And that was just something I just noticed, and it's second set of eyes. Kind of like when you're looking for your keys. Where are my keys? I can't find. Someone says, oh, look, here are your keys. It takes a village. It's a group of people, a team of doctors helping you stay healthy. So just make sure that you keep up with your dental visits, that you don't skip dental visits, because we are not just looking at teeth. We're also looking at the health of your head and neck and the skin to help, save your head and neck. Okay. If you have any more questions, give us a call at 925-254-4043, or look us up. Look at our office up at www.orindadentist.com. All right, make sure you click a like in this video if you found it helpful, subscribe to the channel, or pass it on to other friends and relatives that could make good use of this video. All right, see you at your next visit. Bye-bye.